Okay, so there we go. Chapter 11, we're going to be discussing muscles. Today, we're going to start off talking about the axial muscles. And the nice thing is that when we discuss the muscles for this class, we're going to divide the muscles up into two divisions. The axial muscles, those are going to be the muscles that are going to be affiliated with the axial skeleton in some way, shape, or form. All right, either through the origins and insertions, how they affect parts of the axial skeleton. And then the other division is going to be the appendicular division. That's going to have to do with the upper and lower extremities here. So tonight we're going to discuss about what an origin and insertion is. But when we're talking about the axial muscles, we're going to see and discuss what their effect is on the actual axial skeleton. We know the axial skeleton is made up of the head, the vertebral column, and the thoracic cage. And so we'll see how these muscles move the head and how they support and move the vertebral column. All right, we'll also talk about muscles of facial expression. So we'll see how they are involved in nonverbal communication, muscles of mastication, that's going to be for chewing. And then some of the muscles we'll finish up tonight by talking about the muscles that aid in breathing. Mainly that's going to be the diaphragm, but we've got our external and internal intercostals that will help with that too. And not to as much of a degree as the skeleton or bone does, but some of these muscles will actually protect some of the abdominal and pelvic organs there. All right, and the appendicular muscles are just going to be the muscles that are going to create movement in the upper and lower extremities, and how they will actually cause motion and movement in the pectoral and the pelvic girdles. And you know, the pectoral girdle is made up of the scapula and the clavicle, and the pelvic girdle is going to be made up of the os coxa. So if you want to see this picture reproduced, well, it's actually in your book, but also in your lab study guides for chapter 11, these pictures are reproduced there, and you can go in there and label them if you'd like. Most of these muscles we will learn. I know it can be somewhat overwhelming here, but we will go over many of these muscles for the anterior and posterior regions here. And even though we are in chapter 11 and it's muscles, all right, there are going to be some other structures that aren't just going to be muscles. You're not all the anatomical terms that you were responsible for chapter 11. The majority, I think it's like 95% are going to be muscles, but there's a small percentage that are going to be non-muscular structures like tendons. So we'll work through those. So let's start off by defining what an origin and an insertion is. Now, origin and insertions are older terms, okay, but you should become familiar with those anyways. There's been a movement, and a lot of anatomists are now describing origins and insertions as just attachment sites, okay? But I'm going to define it to you anyways. An origin is going to be the less movable attachment site for a muscle, and the insertion is going to be the more movable attachment site for a muscle. And the example that we like to give is the biceps brachii muscle. I'll show you here on this picture. Okay, so up at the top of our screen there, right, our biceps brachii muscle has two heads, so it has two insertion points. So the origins are going to be up there by the shoulder. And that's going to be the less movable point, so hence we call it the origin. The insertion is going to be down here on the radial tuberosity of the radius here. And that's where our biceps brachii muscle attaches, and when it contracts, right, it causes flexion of the elbow joint. And that means it's going to move the distal part of your upper extremity, the hand, the wrist, and whatnot, right? It's going to approximate that and decrease the angle between the radius and ulna, and decrease the angle between the radius / ulna with the humerus there. Okay, so you'll see that this end here is going to do most of the movement. So that's going to be the insertion point. So here you can see it on our gross dissection up here towards the top. Right, the short head is going to attach onto the coracoid process. We saw what the coracoid process is. We just had a test on that. That's going to be this process that comes off the anterior side of the scapula. And then the long head is going to attach here to the superior portion, all right, of the glenoid fossa here. And then our insertion point will be right here on the radial tuberosity on the radius. All right. So if you look at these muscles, and as we go through this chapter, you're going to see that some muscles have certain patterns of organization. And so there's 4 patterns of what we call the fascicle organization. And what a fascicle is, it's a group of muscle fibers. And if you notice, skeletal muscle is striated, striped, alternating light and dark areas here. And so when we start to gather up a bunch of muscle cells and we'll bundle them together, we're going to create these fascicles. And these fascicles will create these organizational patterns that we're going to see throughout our skeletal muscle fibers. And so there's 4 patterns. There's the circular pattern, the parallel pattern, convergent, and pennate. So we're going to work through all these here for you. Let's start with circular. Circular is it's real easy, okay? The muscle fibers, all right, are going to create rings around some sort of opening or recess. And so these muscles are usually termed as like a sphincter-like muscle. Basically, what they're going to do is they're going to decrease the diameter of that passageway. When it contracts, right, it will shrink that opening down. So there's a couple different types of muscles that are circular muscles that we're going to discuss. One of which is the Orbicularis oris muscle. That's the muscle that goes around your mouth. And so when you contract that, you'll pucker your lips. You have the Orbicularis Oculi muscle that surrounds your eye, your orbits there, the openings to your eyes. And so when you contract that muscle, you'll squint or squeeze your eyes closed. So we'll talk about these different types of circular arranged muscles here in a few moments. Parallel muscles, okay, our fascicles are going to be in a parallel arrangement to the long axis. So we'll see in some of these muscles, all right, the central portion of these muscles will have an expanded area. We saw that here with our biceps brachii muscle. This right here is the belly, and it's an expanded area there. And these muscle fascicles are arranged in a parallel fashion along the long axis of the muscle, up and down, okay? So we'll see in some of the parallel muscles, they will have that central portion, that expanded central region, and we'll call that the muscle belly. So when you contract that area, okay, the muscle belly will expand as the overall muscle shortens, because when muscles contract, they will shorten. And that will increase, all right, that area of the belly there. And so the diameter of the belly will increase. Now, these muscles are great for endurance. Awesome. But they're not so good for strength. So we'll see this in your abdominal region, your 6-pack muscles, the rectus abdominis, and I just showed you the biceps brachii muscle. Convergent muscles, like the title infers, right? You're going to have these muscle fibers converging onto a central point here. In some cases, all right, it can be a tendon, but it's not limited to a tendon. It can also be a tendinous sheet, almost like an aponeurosis, or it could just be some collagen fibers. But regardless, you'll have, all right, these muscle fibers that fan out on one end, and they all come down to this convergent point. And again, it could be a tendon, it could be a sheet, an aponeurosis. So it all just comes down to a central point right down in here. Right. So they'll resemble like a triangular shape. You can see, you know, we have our triangular shape here. The nice thing about these types of muscles, and it's true, the direction of the pull, we can change it. We can modify it. And it depends on which muscle fibers that we're doing. If we do these muscle fibers here, it'll change our direction of pull this way. If we modify the muscles here in the middle, or it's not modify them, if we contract just those, it'll pull this way. Okay, so then that's the nice thing about it. Right? So we can modify the direction of pull depending on which group of muscle fibers we're stimulating to contract. Right? Good thing is it's modifiable. Bad thing is we can't pull as hard as we would with a parallel muscle. Right? And that's even if we were to not modify, if we were to stimulate all the muscle fibers, it still won't be as much. Our last group of organization is the pennant muscles. Okay, now these resemble a feather. So what we'll have is we'll have a tendon, and then we'll have muscle fibers that will come in at an oblique angle and attach onto this tendon. Some will come off just to the side. Some will come in from both sides. All right, so we'll see, we can have one tendon, we can have many tendons. All right, but again, they come in at an angle. And so what we'll see with these types of muscles is that they can generate more muscle tension, so they can generate more power and they're stronger. So we have three types: unipennant, bipennant, and multipennant. So I'm going to show you pictures of these in a moment. All right, so the unipennant, like the name would suggest, you have one side that the muscle fibers come off. And that's what we'll see for a unipennant. Bipennant, this is the most common. This is the one that resembles a feather. You'll have muscle fibers on both sides of our tendon. It'll be more central. And then the multipennant, you'll have a tendon that branches off to like these miniature tendons, and then you'll have muscle fibers coming off of either side. So let's take a peek at all the different fibers here. Okay, so here's our circular. Here's the parallel, muscle fibers up and down, and then here's the convergent. It fans out at one end, and then they all converge onto a central attachment site. And then our pennant muscles are unipennate. Here's our tendon on one side with the fibers coming in. Then we have our bipennate. You have the tendon in the middle and the muscle fibers on both sides. And then our multipennate, you can see the tendon gives off these little mini tendon branches, and it has fibers on both sides. So that's how we organize our muscle fibers. And as we go through and label, you'll see, all right, all these different organization patterns. And you'll be like, all right, now I know what Dr. Kaz was talking about. So one of the things I want to do, because the muscle exam, the third lab exam, can be quite difficult. Okay? Even though you have the neuron on it too, right? But the majority of the test is going to be muscles. And people have issues with naming muscles. Here you can see all the different organizational patterns on a live dissection. So, well, before I talk about naming of muscles, let me just quickly talk about intramuscular injections here, okay? I mentioned how sometimes we'll inject drugs into different tissues depending on some of the characteristic of those tissues. We talked about injecting certain medications into the subcutaneous layer of your body, okay? Almost said the skin, but it's not part of the skin, okay? But the reason why we do that is because it's highly vascularized. If we want to get the drug into circulation quickly, we'll give you a subcutaneous injection. Now, when we want to give you an intramuscular injection, now notice intramuscular is going to be right into the muscle, right, using a shot. We are going to utilize this method of injection to give a large amount of medication at one time, like a vaccine, perfect example, right? Your DTaP. Right, the nice thing about injecting it into the muscle is, yes, it has lots of blood vessels there, but we can get a nice slow and uniform delivery, which in cases can be better than an oral administration or an IV. So if you've ever noticed, when you go to go get your tetanus shot, you know, for the next couple of days after you get the shot, it hurts. All right, that's because they injected it right into the muscle tissue. All right, and it's got that nice slow delivery form. So very commonly, you'll have it's either going to be in the rear end or in the glutes. Right, some folks, I've got some patients that will give themselves injections into the quadriceps, which again is another good site. But normally with vaccines, we'll usually do it right into the arm itself. All right, let me go back to what I was talking about naming muscles. The third lab exam is going to be the majority of the questions are on the muscles. And if you understand how we name the muscles the way you do, or the way we do, it will help you in studying this. I'm not saying to memorize the whole how we name skeletal muscles, but as we're going through some of this stuff, we'll see, all right, how the names of the muscles, when you're taking the test and you're looking at a muscle and you're like, man, I'm drawing a blank. Start to ask yourself, what does this muscle look like? What's the shape of it? All right, what does this muscle do? And maybe that will jog your memory as to the name of the muscle. So there's several different ways that we name muscles. We don't use the same method on every single muscle. Okay, some muscles use a couple of these nomenclature rules, not all of them. So the first way that we can name a muscle is by what it does. All right, what is its primary function? All right, does it flex? Does it extend? Does it supinate? Does it pronate? All right, so we'll see that some of the names of these muscles, for example, flexor digitorum longus. Flexor tells you that this muscle is going to flex something. Well, the next name in the name of this muscle, digitorum, tells me that it flexes the digits. Okay, it could be the fingers, it could be the toes, but it flexes the digits. And then longus tells me how big this muscle is. Is it short or is it long? Obviously, it's long. The second way that we name muscles is, all right, the specific area or region to which we find this muscle. For example, the muscle listed here, the tibialis anterior, that's the muscle that sits on the front of your tibia, on your shin. When you get shin splints, this muscle becomes irritated. And so when you look at the name tibialis anterior, well, we know what the tibia is. It's in my leg, all right? And then anterior tells you that it's on the front of my tibia, on your shin. Muscles that are going to be close to the surface of your skin, we'll usually call that superficialis or externus. And our deeper muscles are either going to be profundus or internus. So again, when you see a muscle with either of those terms in it, it'll tell you how close it is to the skin or how deep it is. Our third way of naming muscles is to where they attach. Okay, so some muscles, if they're a basic muscle, they'll have one site or one origin and one insertion. Some muscles might have more than one origin, or they might have more than one insertion. So basically, when we talk about the muscle attachment, right, we're going to start, the first part of the name is usually the origin, whereas the second part or the latter part of the name will be the insertion. Now, if you notice this muscle that's listed here, the sternocleidomastoid. Sterno, all right, is one part of our word. Cleido is another, and then mastoid. So these are three different words in the title of our muscle. So sterno refers to the sternum. Cleido refers to the clavicle. So the first two parts of this name refer to the origins. And then the last part is the insertion. That's the mastoid process on the temporal bone. That'll be the more movable portion. So when we see this muscle right here, okay, you can see the clavicle and the sternum is down here. That's going to be the origin. And then your insertion point is going to be back here. All right, that's going to be in the mastoid process. So this muscle is going to be responsible for movement of your head and neck. But the name of it tells you to where it's attaching to. All right, so another method that we use to name muscles is the orientation of those fibers there. And we just went through those different arrangements there for the muscle fibers. So terms like rectus tell us that it's straight up and down, lengthwise. Oblique, okay, it comes in at a specific angle to whatever our reference point is. So we're going to learn about the internal, external oblique muscles. Those are part of your core muscles that sit on the side of your torso or abdomen there. Rectus abdominis, that's that six-pack muscle that we saw. Rectus was those muscles that go straight up and down on the abdomen there. All right, a popular way to name muscles is the shape of the muscle. Okay, deltoid, rhomboid, orbicularis brevis, longus, trapezius, all these different methods here are going to somehow reference the shape of the muscle. Deltoid is going to be a triangle, like delta. Okay, a rhomboid is a four-sided geometrical structure. Orbicularis, we saw that with the circular muscle fibers that go around some sort of passageway. Trapezius, trapezoid, that's going to be a four-sided geometrical structure. All right, then brevis and longus refer to how short or how long these muscles are. All right, muscle size is another method that we use, right, when naming muscles, okay? Gluteus Maximus is a great example, all right? That's in the gluteal region. That's right down by your rear end, right? And Maximus is big, okay? Magnus, again, big, right? We have a muscle called gluteus medius and gluteus minimus. So minimus is really small. Gluteus medius is kind of somewhere in between. All right, so these names are going to help us to describe the muscle size. And then we have our muscle head, or how many tendons that we have for the origin. So when we talk about the tendons of the origin there, and like our muscle bellies, for example, the biceps brachii muscle, biceps, 2 heads, triceps, triceps 3 heads, quadriceps 4 heads. Because that's what you're gonna see some of these terms here that'll help you to give you a decent idea as to how we name, right, some of these muscles. So I want to roll through and talk about some of these muscles here, and then we'll go and we'll label them. All right, so I'd like to start off with some of the muscles of facial expression. All right, so again, these muscles don't really support anything, right, but they will give us some of those nonverbal communication cues there. And so what they'll do is they'll attach onto the skull, but also they can attach onto some of the soft tissue that sits on top of the skull called superficial fascia. I don't know if you remember the superficial fascia. That superficial fascia lies deep just underneath, all right, your skin. All right, so these muscles can attach directly onto the skull, or it can attach to this superficial fascia here. So the first muscle I'd like to talk to you about is called epicranius. Now this muscle is composed of muscle tissue and then another type of connective tissue. All right, so the muscle itself is called the occipital frontalis muscle. And so the occipital frontalis muscle, part of the muscle sits on your forehead, and the other part of this muscle sits on the back side of your head. And it's connected by this thin sheet of connective tissue called the epicranial aponeurosis, or the gala aponeurotica. I'll go over this when we start to label stuff. All right, so when we're talking about the muscular portion of epicranius, the part that sits right on your forehead is the frontal belly of occipital frontalis. Okay, we have another name for that, and I'll show. I don't want to confuse you right now, but there's another name for this muscle. All right, so that sits right on your forehead, helps you to raise your eyebrows. Dwayne Johnson, the Rock, Rock Johnson, he has a very well-developed frontal belly of occipital frontalis because he's able to raise his eyebrows relatively easily. All right, the occipital belly sits on the back of your skull, and so when you contract this muscle, it'll move your scalp around. Almost looks like when you're contracting and relaxing that muscle, that your hair is not attached to your head. It looks like a wig. All right, so here's the frontal belly of epicranius. Sits right above our eyebrows here, and it'll help to raise your eyebrows. Okay, so there's the frontal belly. Back here is the occipital belly, but these two bellies are attached by this connective tissue here, and that is the gala aponeurotica, right, or the epicranial aponeurosis there. So here you can see the occipital belly of epicranius there. All right, the next muscle of facial expression is the orbicularis oculi. This is the one I was telling you that encircles your orbits there. And so when you contract this muscle, helps you to close your eyes or squint. So you step out of a movie theater in the middle of the day, all right, into the direct sunlight, and you're squinting, all right, it's the Orbicularis Oculi muscle that is doing the squinting here. Then we have nasalis. That's the muscle that sits on the bridge of your nose that allows you to flare your nostrils. So there's Orbicularis Oculi. You can see how it encircles the orbits there. And so when you contract that muscle, it causes you to squint. And then there's the nasalis muscle. It sits right there on the bridge of your nose. All right. So some of the muscles that now are going to be associated with your mouth. Orbicularis oris. Again, another circular arranged muscle that goes around the opening to your mouth. So when you contract this muscle, you'll pucker your lips. Depressor anguli oris. Look at the name of this, depressor anguli oris. It tells you the muscle action in the name. It depresses the angles of your mouth. So it pulls the corners of your mouth down, and it'll cause you to have that frown appearance there. So there's Orbicularis oris. And so when you contract that, it causes you to pucker your lips. And then here you can see depressor anguli oris at the corners of your mouth. So when you contract those muscles, you'll pull your mouth down at the corners, giving that frown appearance there. Depressor anguli oris. All right, so we talked about frowning muscles. Let's talk about muscles that make you smile. And there's two of those, all right, Zygomaticus Major and Zygomaticus Minor. Zygo, all right, that comes from the zygomatic bone. So these muscles will attach and originate on the zygomatic bone, and then they will actually attach onto their insertion is going to be the corners of your mouth. So when you contract these muscles, it pulls the corners of your mouth up into a smile. Risoris, this is the laughter muscle, right? This muscle, when you contract it, just pulls your lips back. It attaches onto the corner of the lips, but it's not above it or below it, so it pulls the lips back, and so it tenses the lips, kind of like when you're laughing. Okay, so here you can see Zygomaticus Minor, Zygomaticus Major, and then Risoris here. And then there's depressor anguli oris right here. There we go. All right, a few other muscles here is mentalis, platysma, and the buccinator muscle. All right, mentalis attaches right onto the lower lip. So when you want to give that pouty look to somebody and stick out your bottom lip, that's mentalis. It's going to cause your bottom lip to protrude. Platysma is a huge, broad muscle, and it's the most superficial muscle on the front of your neck. And what it will do is it will tense the skin. And I've got a picture here of a guy actually contracting the muscle. Right, so I can't really do it much justice in describing it to you, but it will tense the skin on the anterior portion of your neck, and it'll also help to pull that inferior lip downwards. Buccinator, if you've played any wind instruments or any instrument basically in which you have to blow on the instrument, the buccinator muscle is a very, very well-developed muscle in those people. And basically what it does is when you're chewing your food, it'll contract and keep your cheeks close to your teeth so the food doesn't fall away from your teeth. It helps to keep the food over the teeth so it's not falling out. So there's platysma. Look at that big old muscle there, all right, that just superficially just drapes on the front of the neck there, covers the clavicles, right? And when it contracts, it'll pull that bottom lip down, but also it'll tense all the skin on your neck. I'll show you a picture of that in a little bit. All right, there's our buccinator muscle, okay? If you play trumpets, there you go, okay? Any wind instrument. So here's this guy I was telling you about. He's going to demonstrate what it looks like when he contracts these muscles. Depressor anguli oris, pulling the lips down. All right, Orbicularis Oculi. You can see how he's squinting and closing his eyes. Zygomaticus Major and Minor will help to pull the lips, all right, the corners of your mouth superiorly, upwards. All right, Orbicularis oris, here's the one in which he's puckering his lips, closing down the diameter of that opening to the mouth, right? The frontal belly of occipital frontalis, right, also known as frontalis, contracting that will help to raise the eyebrows. And then here's platysma. I don't know why, I always get a kick out of this one. Right, you can see this guy is tensing all the muscle here, and it's tensing the skin on the front of his neck here. And at the same time, it's pulling his lip not posteriorly, excuse me, inferiorly. All right, so muscles of facial expression. If you've ever had a condition called Bell's palsy, also known as idiopathic facial nerve paralysis, facial nerve is cranial nerve number 7, right? Idiopathic means we have no idea what causes this. Okay, this is more commonly called Bell's palsy. And we're seeing an increase in the number of Bell's palsy cases being reported lately. Okay, we're not really sure why. Some people have mentioned that it's because of the vaccination. We don't know. Okay, that's being investigated. Like I said, it's idiopathic, so we still don't know. But basically what we do know is the facial nerve becomes inflamed. And anytime there's inflammation involved, there's going to be swelling. And when there's swelling involved, things get pushed on. So the facial nerve, right, is inflamed and it gets compressed because of the inflammation, and it causes the facial nerve, right, to malfunction. And so if the facial nerve is malfunctioning, the muscles that it innervates will not function appropriately. So we get flaccid paralysis. So you'll see drooping of this whole side of the face. You'll get the eyelid, we call that ptosis, will start to droop. The mouth, the corner of the mouth will start to droop. You'll just see like a sagging almost, not literally like your face is going to slide off your skull, but you can see. Sometimes it's confused for a stroke, whereas with the stroke, you're not going to get the whole side of the face paralyzed. Usually it's the bottom quadrant around the mouth. But easy way to treat this is just give them steroids. Prednisone does a great job. It helps to reduce inflammation. It varies depending on how long it takes for the recovery. That varies on how much compression was going on to the nerve, how long that nerve was inflamed. Nerves are very, very sensitive structures. So that being in mind, the recovery time it varies from person to person. All right, muscles of mastication, chewing. All right, there's two major muscles of mastication. There's more than two, but the main two that I want to talk about are going to be temporalis and masseter. But it's these muscles that influence the movement of the only movable joint in your skull, which is the temporomandibular joint. And so that occurs a lot, like right now, me talking, but also when you're chewing, when you're eating your food. So the two major muscles are temporalis and the masseter. The masseter is the stronger of the two. The temporalis is going to be a deep muscle that is going to help to lower, all right, not lower, but it helps to close your mouth, but also it's going to help to retract your jaw, pulling it backwards here. All right, and so it'll sit right on the side of your head, all right, over the temporal bone, and it lies underneath this other muscle called temporoparietalis, which we'll discuss when we're doing labeling here, but it's deep to that muscle. Then the big gun, masseter, this is the one that is the stronger of the two. And so what it does, it also closes the mouth or elevates the jaw, but it'll protract the jaw, push it forward. And so this is the muscle that gets affected if you haven't had your tetanus shot and you don't go do anything about it after stepping on a rusty nail, and you get what we call lockjaw. And it's because your calcium levels are all out of whack, and it causes this muscle to clench so hard that you can't open your mouth. Try that one on for size. So there's temporalis. Temporalis attaches here into the coronoid process here of our mandible. So it helps to close the mouth, and it'll pull the jaw backwards or protract it. And then there's masseter. And you can see how masseter will also close the jaw, close the mouth, and also in this case, it will protract or push the mandible forward. So you can see them both. Now there's two other muscles, right, that are part of muscle of the, oh man, I don't know why that did that, of the muscles of mastication. All right, there's more than just the temporalis and the masseter muscle, but the lateral medial pterygoid muscles, we saw those when we were talking about the pterygoid process that comes off the sphenoid bone. These two muscles help to shift your jaw side to side. So like you're grinding stuff with your molars, they do a great job. They're really deep, okay? All right, let's bust out our atlas and go over some labeling here. Okay, so let's pull up. Here we go. Head and neck. All right. So go ahead, get your atlas out. Let's review and go over some of these muscles. Okay, so here is epicranius. And so when we were talking about epicranius, we have a muscle portion to it, and then we also have a connective tissue portion to it. So you can call this muscle, and we were discussing this just previously here a moment ago, the frontal belly of the occipital frontalis muscle, or you can call it, what I prefer to call it, the frontalis muscle. Much harder to misspell frontalis than it is frontal belly of occipital frontalis muscle. Okay, so here it is on the anterior portion. This is going to be the muscle that raises the eyebrows. Then on the way back to the posterior portion of the muscle, you can see we have this thin sheet here, that connective tissue. Okay, that's the epicranial aponeurosis, also known as the gala aponeurotica. That attaches the frontal belly to the posterior belly. Or you could say that attaches the frontalis muscle to the occipitalis muscle. So if you're looking here on the model, you might notice that the right side of our model looks different from the left side of our model. And I need to mention this. The left side is the deep dissection. The right side is the superficial dissection. So we're going to see the more superficial structures on the right side of this model. And on the left side, you'll see the deeper structures. So when you're looking at some of these models, especially if you can see the front completely and the back completely, you'll see these differences in dissection. Right? So you need to make a note which are more superficial and which are deeper here. All right, so on this side of our model, right, you can see the bone. So if we see bone, we're usually pretty deep. So this is the temporalis muscle. This is that muscle we just talked about that was part of the muscles of mastication. Helps to elevate and close the jaw, and it helps to protract or pull the jaw backwards. So that is going to be temporalis. Then the muscle that sits on top of temporalis, the more superficial muscle, is the temporoparietalis muscle. So this one is superficial. This one is deep. Temporalis is deep. Temporoparietalis is not, it's superficial. Right? Then, staying on our superficial dissection side here, we can see this muscle that surrounds your eye. This is called the Orbicularis Oculi external muscle. All right, so basically, the external portion of this muscle is going to be all of this. Everything in between those two red lines. So this, all of this, that's the external portion. Okay, Orbicularis Oculi external. We have an external, we have an internal. So basically what I tell folks is the internal portion is going to be on the eyelid. Orbicularis Oculi internal. So again, when you contract this muscle, you're going to close your eyes, almost squint. All right. So going down to the mouth, you'll notice a similar type of muscle that encircles the oral cavity there, the opening to your mouth, and that's called orbicularis oris. Orbicularis, think of planets orbiting the sun. The planets orbit the sun in a circular or oval kind of pattern there. All right, that's what orbicularis refers to, that circular type of pattern. Oris is oral mouth. Orbicularis oris. One other thing, when you are taking your exam and it's asking you to identify a muscle, you don't have to write out the whole word muscle every time. If you just put M period, that's good enough. So you could say orbicularis oris M period. And you don't have to keep writing out muscle. All right, let's talk about our smiling muscles. I like to smile. All right, so Zygomaticus Minor is going to help me to do that. And so here you can see is Zygomaticus Minor. Now, in just a few moments ago, we were talking about Zygomaticus Minor and Zygomaticus Major. So when you talk about muscles that have minor or major in their name, usually those muscles will be close to one another. A major will be close to a minor. But I have a rule, okay? The minor is always above the major. What that means is the minor is always superior to the major. Now look, there's Zygomaticus Minor. On the next slide, there's Zygomaticus Major. So you can see how Zygomaticus Major is down here. Right? So Zygomaticus Major is below Zygomaticus Minor. So I always tell folks the minor is above the major. All right. Our next muscle associated with the mouth is the depressor anguli oris muscle. And you can see this muscle is going to attach to the corner of your mouth. All right. And it's going to pull the corners down and give you that frowning expression. That's the depressor anguli oris muscle. And then another muscle associated with the mouth is mentalis. That's the pouty lip muscle. When you contract these muscles, you will protrude your bottom lip outwards, giving you that pouting expression. Nasalis, that's the one right there on the bridge of your nose. This is going to be the one when you contract, it causes your nostrils to flare. And that's nasalis. And then here's our other muscle of mastication, the masseter muscle, sitting right there on the ramus, right along the angle of your jaw there. That's the masseter muscle. Rizoris, that's the laughter muscle. This is the one when it contracts, it pulls the corners of your mouth just backwards and it tenses the lips. That's the rizoris muscle. And here's the buccinator muscle, the one that when you are chewing, it will contract and keep your cheeks, all right, over your, or close to your teeth, I should say, not over, because then you'd be biting your cheek. It will keep the cheeks close to your teeth, so it helps to keep the food over your teeth so it's not falling away from the teeth and you're not able to chew your food. All right, so we're going to leave the face now, and we're going to start to move down into our neck. We're going to talk about some of the muscles that we see in our neck. Here's that muscle that we talked about that it's named after its locations, its attachment points. Sternocleidoid mastoid muscle, right? So this muscle is going to be located in the anterior and lateral portions of your neck. Deep to that muscle, we have our levator scapular muscle. And levator scapulae muscle tells you right, what the muscle does. So it elevates the scapula. So it attaches onto the upper portion of your cervical spine, and then it travels all the way down to the top corner called the angle of your scapula. That's that corner of the scapula where the superior border and the medial border meet each other. You can see it better from this angle here, okay? That's the levator scapula muscle. Then we have another muscle, splenius capitis. And so in the description of this muscle, the name of this muscle, you'll see capitis in the name, and that's telling you that this muscle is going to affect the movement of your skull. Cap, skull, right? So you can see it here attaching onto the mastoid process there of the temporal bone, but you can see it better here on the posterior view. That's the splenius capitis muscle. All right, trapezius muscle. This is that muscle that we named, all right, that is in the shape of a trapezoid, like a big diamond. It's a four-sided shaped structure. And so I'll show you a couple different appearances of it and how it looks. But the trapezius muscle attaches onto your skull, then it travels down and out to your shoulders, and then it travels back in towards your T12. So it's described as a big diamond-shaped muscle. So this picture here shows you the upper fibers, the fibers that attach onto the neck, your skull, and your shoulders. So that's the trapezius muscle. It's the most superficial muscle, all right, of your back in the thoracic region there. All right, now you're going to meet a family of muscles called the scalenes, and there's three of them. All right, we have the scalene sisters here. The first one, the one that's most anterior, is the anterior scalene. Then we've got our next muscle, which is the middle scalene. And then right behind the middle scalene muscle is the posterior scalene muscle. So anterior scalene, middle scalene, posterior scalene. Okay, that's it for the head and neck. I want to do one more labeling here. And that's going to be for the torso. Okay. So the first item here is not a muscle. The linea alba is not a muscle, okay? It is an anatomical landmark. It's essentially in the direct center, the median portion of your body there. You can see it's coming off of the xiphoid process there, right? It's traveling all the way down, right, to your pubic symphysis, okay? That is called the linea alba. Now, the linea alba, for whatever reason, in pregnant women, darkens. They get increased melanocyte activity, an increase in melanin content. So that region there will darken during pregnancy. You know, it's believed to be hormone-related phenomena. And so we don't call it the linea albia anymore. We call it the linea nigrans. And so you'll see that in pregnant women, that area there will just become dark. But now we'll see a muscle here in the abdomen, and this is the rectus abdominis muscle. This is a parallel muscle fiber type of muscle. All right, rectus, straight up and down, those fibers are running along the longitudinal axis there, and it is found in the abdominal region. So this is the rectus abdominal muscle. So where the red is, that's the muscle portion. Now, what I'm going to do here is I'm going to take a knife, okay, and I am going to cut this part out and flip it over. We're going to look at that from the inside, and that's what we're seeing here. Here's the rectus abdominis muscle, right, from an internal view. I'm on the inside looking out. So you can see the rectus abdominis muscle internally. Here it is externally. All right. Going superior to that, up in the ribs, you can see the subcostal muscle. Subcostal muscle. Okay, in order to be the subcostal muscle, it has to be ribs are in the vicinity. If there's no ribs in the vicinity, costal means rib. You don't even really need to be mentioning that. All right, here you can see another structure that is not a muscle. These are called tendinous intersections. That's where the muscle bellies of rectus abdominis attach onto. And so we call those tendinous intersections. All right, staying with the core muscles here, let's talk about the obliques. All right, the most superficial lateral muscle in your abdomen is the external oblique. The muscle fibers for this muscle, they run down and in, like you're putting your fingers or hands down into your front pockets there. All right, that's the external oblique. Now, when we peel that away, we come across the internal oblique. Those muscle fibers run up and in. Okay, that's the internal oblique. That's going to be deeper to the external oblique. And we've got another muscle that's deep to the internal oblique, and that's called the transversus, because the muscle fibers move in the transverse plane side to side there. That's called the Transversus Abdominis. Notice, above that line that I just drew, that's where the ribs are. Below that line, all right, there's no ribs there. So that's the Transversus Abdominis. So if I'm below the ribs, I'm in the abdominal region there. So we call the muscle fibers down there Transversus Abdominis. Because there's another muscle that I'm going to show you here in a moment, all right, that does the same thing. The muscle fibers run transversely from side to side, except it's up where there's ribs. So we call that the transversus thoracis, but we'll see that in a little bit. All right, so you have a muscle that actually attaches onto the lumbar spine, and it comes off the lumbar spine, and it moves down into the pelvic cavity, and then eventually it'll move down into your thigh, your lower extremity there. So this muscle is called the psoas major muscle. Psoas major muscle. I'll show you it from on another model here. There's the psoas major. These are your iliac crests in case you're trying to figure out where you are. And then you can see this area here, all right, is the lumbar region of your spine. Why? I know this because there's no ribs. The ribs are only present in the thoracic region of your spine. Okay, so the psoas major muscle attaches on to the lumbar region of your spine, and it goes down into the pelvic cavity, and then eventually it'll make its way into the lower extremity. Just lateral to that is the quadratus lumborum muscle. This is this rectangular shaped muscle. You can see it a little bit better here on our right side. All right, the quadratus lumborum muscle is going to help to keep you upright. In fact, all of you are using that muscle right now. But the nice thing about the quadratus lumborum muscle is the muscle tells you, the name of it tells you two things. One, the shape of the muscle. It's in the shape of a quadrilateral structure, which is a four-sided structure. And it tells you where it's located, in lumborum, in the lumbar region. So it's quadratus lumborum muscle. Here's iliacus. This muscle here sits in the iliac fossa. Well, we just learned about the iliac fossa not too long ago. Right? That's that smooth area of the ilium, right, which is part of the os coxa. And that's where this muscle sits. It sits in the iliac fossa, that nice smooth area there. And you can see it's just lateral to the psoas major muscle. And so iliacus and psoas major are going to combine forces and fuse together to form a new muscle, but we'll talk about that at another time. Here you can see the iliacus muscle here on this model. Again, it sits right there on that iliac fossa, doing the iliac fossa thing. All right, on the posterior part of your back, you'll see this group of muscles here called the erector spinae muscle. So look at the name. It tells you what it does. Okay, it helps to keep your spine upright or erect. These are the deepest group of muscles that sit on your back, and they run the entire length of your back, all the way up your neck, all the way down your spine, down to your low back there. That's called the erector spinae muscle. Okay, so they help to keep you upright. When you go to bend over, so when you bend over and you go to straighten back up, you are going to utilize these muscles to help straighten yourself back up. Here's a nice picture of the trapezius muscle. Check it out. Like I said, it attaches onto the base of your skull. It goes down on the cervical spine out to your shoulder and then back down here to T12. So if it was on both sides, it would look like a diamond. The trapezius muscle. It's the most superficial muscle on your back there. Right? Down below the trapezius muscle is the latissimus dorsi muscle. This is a cool muscle because it's well developed in swimmers, especially if you do the butterfly stroke. Anybody that does a lot of rowing, okay, this muscle becomes highly developed. And anybody that is familiar with pull-ups, if you've been in the military, okay, the latissimus dorsi muscle is well developed because it helps with that pulling down motion. Don't refer to it as this, but it's often referred to as the lats, okay, just like your trapezius muscle is referred to as the traps. All right, the deltoid muscle. This is one of those multi-pinnate muscles, right, in which we saw, okay, a lot of little mini tendons with muscle fibers attaching to it. Now, the deltoid muscle gives you that rounded contour shape to your shoulder. And so we're going to see that there's three different views to this muscle. This is the posterior view, so you can see the posterior muscle fibers. Then we're going to switch to the front. This is the anterior view. So you can see all those are the anterior muscle fibers. And then I'll show you the lateral view. And if you look, the deltoid muscle looks like a triangle. Right, so delta, deltoid, right, the deltoid muscle. Now on the back, in your thoracic region of your spine, you've got two muscles that attach the scapula to your spine. The one here that the arrow is pointing to is the rhomboid major muscle. And again, a rhomboid is a four-sided geometrical shape. And so that's what we're seeing here. That's the rhomboid major muscle, or rhomboideus major. And remember what I said about majors and minor. The minor is above the major, so there's rhomboid minor. Sits right above the major right here. Rhomboid minor, rhomboideus minor. So when you contract those muscles, you're going to draw your shoulder blade close to the spine. All right, then you have teres major. That's this fella right here. That is superior to the latissimus dorsi muscle. Teres major. There is a teres minor. We'll talk about that at another time. You can see it on this view here. All right, that's the teres major muscle. And now I'm just going to flip the arm over. This is if you were standing next to me and your hand was down to your side, this is the view that I would see. Now I'm just going to look at the inside of your arm. Here you can see it from the inside. All right, that's the teres major muscle. All right, also on your back is the serratus posterior muscle. Now, serratus comes from serrated. If you've ever seen a serrated knife, it's a jagged knife edge. And that's what this, because this muscle attaches onto the ribs, it gives that serrated type of appearance to it, that jagged appearance. So that's the serratus posterior muscle. You do have a serratus anterior muscle that I'll show you here in a moment. So that's the serratus posterior. On the inside here, again, this is the internal view. This is that muscle I was telling you about before. We're up in the rib cage here. These muscle fibers are going side to side. This is transversus thoracis. Okay, transversus thoracis. And then on our chest, all right, we have the pectoralis major muscle. This is that muscle that we were describing with the fascicle arrangement. This is the convergent type. Okay, it fans out here on the origin. And then all these fibers will converge onto a tendon that attaches onto the humerus. Pectoralis major. This muscle here is for pushing away. Football players use it all the time, linemen, when they're pushing on each other. Pectoralis major. You have a pectoralis minor, but you don't need to know it for identification purposes for this class. But the pectoralis minor muscle sits right underneath that. All right, here's the serratus anterior muscle. It's tough to see from this angle, but where it attaches onto the ribs, it gives that serrated type of appearance here and here and here and here and here. Right, that's the serratus anterior muscle. Now, all I'm going to do with my model here is I'm just going to rotate it towards us a little bit. You don't have this next picture in your atlas, but I'm going to rotate it a little bit for you. Here you can see it a little bit better. There's the serratus anterior muscle. All right, and then our final group of muscles that we're going to identify are some of our muscles of respiration here. All right, so the external intercostal muscles, right, you'll see them more lateral, and those fibers move down and in, similar to what we saw with the external oblique muscles. So these muscles help to elevate the ribs. Open them up during inspiration. It's the external intercostal muscles. We'll rotate our model a little bit so you can get a little bit of a better view there. And then we have another muscle that sits perpendicular to the external intercostals, and those are our internal intercostals. So those muscle fibers go in this direction. Kind of like down and out, or up and out. But they're perpendicular to our external intercostal muscle fibers. So the internal intercostal muscle fibers are going to depress the ribs during expiration. So we'll just rotate our model so you can see it a little bit better. Internal intercostal muscles. And then finally, the greatest respiratory muscle of all, the diaphragm. Okay, so this whole structure is the diaphragm. The arrow's pointing to the red part. That's the muscle tissue. So on a test, if you see this, all right, and it's pointing to the red part, then you're going to describe it as the muscular portion of the diaphragm. Right, if the arrow is pointing to the white part, that's the central tendon. So you can see a couple holes here in our diaphragm. The first hole that we're going to look at is known as the Caval Hiatus. That's when the inferior vena cava, that's the blood vessel that returns deoxygenated blood to your heart from the lower part of your body. So it has to come and punch its way through up through the diaphragm. So that's the Caval Hiatus, Right next to it, more midline, is the esophageal hiatus. You can probably figure out what moves through that. The esophagus, when it's descending down from your mouth towards the stomach, because the stomach sits inferior or below the diaphragm, right? The esophageal hiatus allows the esophagus to punch through and go into the stomach. And then we've got one other structure here, right there. That's the aortic hiatus. That's where your descending aorta, that's the blood vessel that carries oxygenated blood. It's going to travel down into your abdominal pelvic cavity and then start giving off branches so we can supply all the tissues in the lower half of your body. So that is the aortic hiatus. And that, my friends, is the last slide. We don't have time to really start anything new, so we'll end here early. But those are all the slides of the axial muscles.